Hey guys, this is Dr. Stoker in Los Angeles. I want to talk to you today about this interesting case on a beautiful young woman who wants to do breast augmentation. She has a slender, athletic build. She's about a 32-inch circumference and a full A cup. She would like to be a small C cup. And here are the significant variables that we're going to consider. First of all, I can tell just by feeling in her circumference, she's smaller than average here. It's a 32, not a 34. So whatever implant we put on her, it's going to have a bigger impact than somebody who has a larger chest, like a 34, which is more average. She has a well-defined inframammary crease and a pretty symmetrical distance between the nipple and the crease here. So she doesn't need a different procedure on either side. That's an important consideration. She has a nice curvature of the medial aspect of her breast here. Sometimes this space is very short and tight. It's key if you've got a little bit extra to work with there because she can accommodate a larger implant. If it were very tight here and we put in a large implant, that implant would tend to bulge out over here, the nipple wouldn't slide over as much, and the breast would look more artificial and somewhat off balance. We're going to put this implant underneath her pectoralis major muscle here. When we push the breast together, that kind of simulates the type of cleavage that we can expect from her, but a little bit more than this. But this distance here that we see it's a pretty decent approximation for what we should expect. Now, in her particular case, she already looks beautiful, whether or not we do implants. We don't need to transform her. She doesn't want some enormous change, and she doesn't want an excessively artificial appearance with too much fullness up here or too much fullness out there. So what are the key variables to that, to getting a natural looking breast? Well, we don't want an implant that is too wide here because this position is going to be somewhat fixed down by this crease. We're going to push it down a little bit, but as the implant gets wider and wider, it's going to start to create an unnatural upper pole fullness here with the nipple being lower than ideal. So in general, that means don't go too big with the implant, but also if you're in that borderline range, we probably would shift over to a high profile implant that is narrower but projects out more rather than going with a moderate profile implant that's going to be too full up here or too full up there. There are different incisions that we can use as well. There are areolar incisions and there are inframammary incisions. There are axillary incisions, umbilical incisions. Most of the time these days we're doing inframammary incisions. There are advantages and there are disadvantages. One advantage is we stay entirely behind the breast and there's actually a lower reoperation rate overall. But it's not the right choice for all patients. In her case in particular, she looks so beautiful here. She knows that she's going to wear a tiny little bikini. And she does not want to have a little mark down here. She thinks that might be visible. Even if it heals well, if you're at the beach and it's very well lit, it is possible that you could see that a little bit. So she's making the educated, carefully considered decision to use an areolar incision instead, which will be super discreet and hidden underneath even the smallest bikini. There are textured and smooth implants. There are pros and cons to each. Now we're using more smooth implants than textured for a variety of reasons, and that's what she's choosing today. A key advantage for her is that she is ultra thin. She's got very little body fat covering up this implant, so you might feel that implant a little bit on the sides here, especially if it's a thicker, more textured implant. For that reason and others, we're going to put the implant underneath the pectoralis major muscle here so that you have thick tissue covering the implant. We're going to use a smooth implant on the side so you can't feel that implant very much. I mean, I can see her heart beating here through her skin and her ribs, so it wouldn't take much to be able to see that implant, so the smooth is going to be the better choice for her. Those are the basics on how we approach a petite, athletic young woman considering breast augmentation.